Welcome to our video on what is involved with veneer teeth. Are you considering having your teeth replaced with dental veneers? If so, you might be wondering what is involved. In this article, we'll discuss the components of a dental veneer, the procedures involved, the cost, and the expected lifespan. Before you decide to go ahead and get veneers, there are some important things to consider. Keep watching to learn more. Also, don't forget to check out our information on the longevity of veneer teeth. Components of a dental veneer. In addition to cosmetic dentistry, the dental veneer procedure can correct several other dental problems, including uneven shapes, worn-out enamel, and visible gaps between teeth. To get started, a dentist takes impressions of your teeth and sends them to a lab for manufacturing. The lab then prepares the veneers using the impressions and the dentist's instructions. The entire process can take up to 10 days, and the longer it takes, the more likely it will overlap with the healing process of your gums. A dental veneer is a thin shell of material made of porcelain or a variety of composite materials. These shells cover the front surface of each tooth, restoring the appearance of the smile. The process requires the removal of 0.5 millimeter of the existing tooth's enamel, but the results are worth it. Veneers are designed to match the color of your existing teeth and can correct numerous other visible dental problems. Usually, veneers are made of porcelain or composite resin. Porcelain veneers are more natural-looking and durable than composite resin veneers. Porcelain veneers are more expensive than composite resin veneers, but they are both durable and look more like natural teeth. Porcelain veneers are more natural-looking than composite resin veneers, as they are made of materials similar to enamel. Porcelain veneers are also stain-resistant, and they look like real teeth. Dental veneers are thin shells of composite resin or porcelain that fit over the front surface of a tooth. They can improve the appearance of teeth, including discolored teeth, stained teeth, or misaligned teeth. Veneers can also correct a wide variety of related dental problems, such as uneven spacing, worn-down teeth, or chipped or cracked teeth. With proper care, dental veneers can improve your smile for years to come. Procedures involved in placing a veneer. Once you have decided that veneers are the right treatment for your smile, the next step is determining what kind of treatment will be most appropriate for you. While this procedure may seem complex, it is actually quite simple. The first step is to decide on the color of the veneer. A trial paste or cement is applied to the tooth in order to determine the best color. The cement will be applied to the tooth and should be left on for several days to set. If you want to change the color of the cement, you must return to your dentist to have it done again. After bonding, the color will not be changed. Before placing the veneer, the dentist must prepare the tooth. This involves removing a small piece of the tooth's enamel. This will allow the dentist to fit the thin porcelain piece. The amount of enamel removed will depend on the dentist. After this, the dentist will create a custom impression of the patient's mouth. This will allow the dentist to accurately measure the placement of the veneer on the tooth. After the impression is complete, the dentist will begin the actual procedure. After preparing the teeth and removing any loose teeth, the dentist will place the veneers. In this process, the dentist will use a grinding tool to create a rougher surface on the teeth, making the veneers stick better to the teeth. Dental cement will be applied to the teeth and harden with ultraviolet light. The second appointment with a dentist will take about 2 hours, depending on the number of veneers that you have and whether or not the dentist used a local anesthetic during the first visit. A direct veneer is another type of veneer. The dentist will need to carefully prepare the tooth before the procedure. Indirect veneers, on the other hand, require a laboratory to create the veneer. Both methods can be a long process, and you should be aware of all the steps involved in the procedure. There are several advantages and disadvantages to choosing the right type of veneer for you. If you are unhappy with your teeth, it may be time to consider this treatment. Cost of a dental veneer. Dental veneers come in two main types, resin and porcelain. Resin veneers are cheaper and are often used for fillings. Porcelain veneers are more expensive and require a more complex process, but are much more durable than resin veneers. They may last 10 years or more with proper care. Porcelain veneers can be as expensive as $2,500 per tooth, but they will last much longer. Because the cost of a dental veneer is considered a cosmetic procedure, many insurance plans will not cover it. However, if your insurance plan does cover cosmetic procedures, your dentist will work with you to find a payment plan that will cover the cost. There are many options, including dental financing and saving. However, it is important to consider your insurance plan's policy before choosing a cosmetic dentist. While dental insurance coverage may not cover veneers, many dentists will still work with you to find a payment plan that will cover the cost of a dental veneer. Having nice teeth can be a huge confidence booster. It also makes you more attractive to potential dates. If you have a perfect smile, it will make you feel more confident. Also, employers will judge a person's teeth during an interview. If they look bad, it might indicate poor oral hygiene, which may make them untrustworthy. Employers want to hire people with confidence and a beautiful smile, so veneers can be a perfect way to boost your chances of landing a dream job. Whether you'd prefer a permanent or temporary dental crown, veneers can completely change your smile. They are effective for correcting damage to the teeth, such as significant tooth decay, and can enhance the look of a smile. Fortunately, you can find affordable options for this cosmetic procedure online. The process itself is relatively painless, and most dentists will even accept payment via credit card. When the cost is right for you, the results are worth it. When you first get veneers, you'll need to take a small piece of enamel off of your teeth. The veneer will then be replaced with a thin porcelain piece. After a few weeks, you'll be able to eat as normal. However, it's important to brush your teeth well after drinking red wine or soda. Drinking too much of these things can also damage your veneers, so you should be cautious when drinking them. Longevity of a dental veneer. The durability of dental veneers varies. Porcelain veneers, for example, may last for 10 years while composites are said to last only 5 years or less. Composite veneers, on the other hand, can be fabricated right in the dental office while you wait. Direct composite veneers are sculpted on the teeth. A tooth-colored resin is applied directly to the teeth and then shaped by the dentist. While tooth enamel is the most reliable substrate for veneers, the process of applying the veneers will eventually wear down tooth enamel. This means that the second placement of veneers will require removing more enamel than the first one. If you replace the veneers without a good reason, you may be left with a suboptimal amount of enamel. In general, these problems will not be readily apparent, but if you notice any issues, you can get an alternative restoration, such as cosmetic bonding or a dental crown. In addition to using a mouthguard when playing contact sports, you should avoid grinding your teeth. This practice puts too much pressure on the veneers, which can make them chipped. Other habits that can damage veneers include using them as tools and biting on hard foods. As a result, it can reduce the longevity of your veneer. In addition, you should avoid eating staining food, such as coffee, red wine, blueberries, and even your mouthwash. Using a bite guard while sleeping is recommended by your dentist. A dental veneer's lifespan can be influenced by several factors, including the quality of the material and the condition of your teeth. Porcelain veneers generally last longer than composite ones, but they are more expensive. Besides proper oral hygiene, you should also consider the use of mouthguards while playing contact sports, as this puts additional pressure on the veneers. Also, teeth grinding can lead to damage to veneers, so you might want to consider wearing a night guard. While dental veneers may last for many years without chipping or discoloring, overly vigorous dental care can cause them to break. This is why it's vital to use mouthwash with a pH-neutral solution. You should also avoid chewing extremely hard objects, such as ice. Ice and hard objects can easily break the veneers. A gentle approach is essential to maintain the beauty and durability of your dental veneer. Thanks for watching. Please like, comment, and subscribe for more.